Hello, ladies and gentlemen. I wanted to give you an overall view of liposuction as it relates to lipedema, okay? We use liposuction usually for three main reasons. One is for cosmetic reasons, to improve the shape or the contour of the body. Number two, we use it for reconstructive purposes, like we do liposuction and then use the fat for facial rejuvenation or reconstruction of the breast to do the buttocks and so forth. And then the third is lipedema. And lipedema is a completely different beast. I want you to think that even though some people tell you, oh, the liposuction is the same all across the board, unfortunately it's not. And when somebody tells you that it is the same, chances are they're just starting to treat lipedema patients. Once you do a few hundred of cases like we did, our perspective changes, our understanding of the disease process changes, our understanding what liposuction does changes. So let's quickly go over cosmetic lipos. So you have usually a lady or a gentleman coming in, they don't like certain areas of the body. And then we do liposuction or remove those extra areas on the hips, on the thighs, whatever they might be. The point of it is we treat isolated areas. We do not treat the whole body. We just treat those areas and improve the contour. The purpose is not to remove more tissues. The purpose is to create the contour. So sometimes you take more, sometimes you take less, but it's all based on appearance, okay? With lipedema, it's a completely different story. With lipedema, we're trying to remove the diseased tissues. It is not cosmetic, it's reconstructive. How do I explain what lipedema is on the inside? I can explain it to you in two ways. Just imagine you're standing under the grape tree and you're looking at all those grapes hanging underneath. Or if you go to a party store and you see all these balloons hanging from underneath the ceiling. That's what lipedema fat looks like. It's not a smooth fat, it's just lobules and lobules of bigger or smaller looking grapes hanging at different levels. So our goal is to remove those diseased lipedema tissues as much as we can, okay? Now, we use the same liposuction cannulas, that is true. We use the same solutions that are called tumescent solutions that are designed to loosen up the tissues, decrease the pain, decrease the bleeding. That's also true. But the technique is different. The approach is different. So if you look at the body, you have the skin, you have fascia in the middle, and then you have the muscles. So you really have two main fat compartments between the skin and the fascia, and then between the fascia and the muscles. Okay, usually the bottom compartment is a little bit larger. If we go into the lower compartment, okay, that's where a lot of lipedema is going to be, and that's where the large volume of the tissues is going to be removed from. And then there is a superficial compartment. It can also have lipedema, but if you're overly aggressive in that layer, you're going to have significantly more scarring, more indentations, and you're not going to have a good cosmetic result. So when we do lipedema surgery, remember, we're trying to remove the diseased tissues. So in those areas, remember, in the top and the bottom, you have two kinds of fat. You have normal fat, and then you have lipedema fat. And we really cannot differentiate them. We cannot selectively remove only lipedema fat, okay? We have to remove kind of whatever is out there. And when you remove lipedema fat, it doesn't come out smoothly. It's clumps and clumps and clumps and clumps. So when we use liposuction cannula, if we use a very tiny liposuction cannula, it's really hard to remove the big blobs of lipedema because the blobs of lipedema fat could be surrounded with a little scar tissue. They can be calcified, they can be hard to poke through. So the small cannulas don't suck them out. If you go with the bigger cannulas, they will come out, but they come out as clumps. So you're doing liposuction and those come out and you end up with little divots. And a lot of times we get the patients coming in and they're saying, well, we want to have as much lipedema fat removed as possible. But what they don't understand is that if we're overly aggressive with lipedema surgery, you're going to end up with really unacceptable cosmetic result, okay? So when we do lipedema liposuction, we have to balance the removal of normal fat and removal of lipedema fat and with final cosmetic results. So even though I'm doing surgical procedure for lipedema, reconstructive surgery, okay, on the back of my mind, I still have to think, how is this person going to look eventually after we're done? Because they obviously want to look as good as possibly can, and I want to avoid things that cannot be fixed, even with secondary surgeries. So the thinking is different. We're removing diseased fat. We're not just contouring. The second thing is, how does physiologically it works? And again, my theory is that the lipedema and lipolymphedema, the reason it happens is because you have the abnormal functioning lymphatic vessels. So you have very stretchable tissues. The connective tissue is not functioning well. We cannot fix that connective tissue. What we can do, we can lay down circumferential layer of a scar tissue through liposuction that works as, I would say, internal stocking, okay? It's an internal stocking, invisible stocking that sits inside of your leg and creates that little stiffness, decreases the body's ability to stretch it. The importance of that is that if you believe in this theory, and I do, that I need to do circumferential treatment of the lower extremities all the time. So let's say the patient comes in and say, I have lipedema in my thighs only, that's all I want to do. Obviously, we can do that. But then I expect that whenever the patient hits the next hormonal crisis, be that pregnancy, IVF, some hormonal therapy, obviously menopause, the other areas of the leg are going to be affected. So usually what I do, even if the lower leg is not affected, I would still do very mild contouring liposuction, even though I don't remove too much scar, too much fat, because I am trying to, remember, create that internal stocking. And I didn't really understand it when I started several years ago, when I started doing lipedema surgery. But as I saw patients coming back, especially when they come back with early menopause, and they say, oh, now I have lipedema in the areas that were not treated, I realized that I really need to be more proactive. So whenever you look for a lipedema surgeon, look for somebody who is really experienced in lipedema. Just because they know how to do liposuction does not mean they're doing the right thing for you in the long term. So the difference with liposuction for lipedema is, again, I believe we need to do it circumferentially, not just in isolated areas, okay? Now, there are several ways of approaching it. I do not like when people do one leg at a time, and I'll tell you why. You never know what's going to happen. You're going to have some changes in your personal life. You're going to have changes in health or whatever reason. When you've done only one leg, you are committed to have the next surgery, okay? That's why we never do one leg at a time. And I've seen some on the internet that some patients having one leg done at a time because of the safety concerns. I don't understand those safety concerns. If you know what you're doing, there should be no safety concerns in that sense. Just do both legs symmetric fashion. So that's kind of one other approach. But when you do the lower extremities, you can do them in portions, or you can do the whole extremity, depending on the volume, depending on the size, and so forth. So there are doctors that do the surgery on an outpatient basis. There are outpatient regulations that allow us to remove not more than 5 liters of aspirate, fat, and water at the same time on the outpatient basis before we have to send the patient for overnight observation. So the people who do it on an outpatient basis without having permission for overnight observation in their facility, they cannot go over 5 liters. So what they would do, say, the lower legs first, and then they do the inner thighs, and then the outer thighs, and the back of the thighs. And they keep doing that surgery 3, 4, 5, 6, 7, 8 times, and they do it on a monthly basis. Each of those surgeries is easier to recover from than from a bigger one, but you require more surgeries. I'm not saying that one way necessarily 100% better than the other. You have to look at your lifestyle, at your availability of free time to recover, and see which approach is better. But again, one of the approaches is smaller surgeries, up to 5 liters on a monthly or bi-monthly basis, okay? Then there are more extensive surgeries when we remove more than 5 liters. And in my practice, majority of patients have higher BMI, so we remove from 8 to 15 liters per surgery, okay? Now, what we do is we treat both legs at the same time. We go from ankle all the way to the hip, and sometimes a little higher. We treat the front, inside, and outside of both legs at the same time, but we do not treat the back. And the reason we do it, that we try to preserve an intact area of lymphatics, just in case if with the swelling, the body has a hard time recovering or slows down the recovery. Then, once the tissue is softened up, approximately 3 months, we bring you back and we do the other side. And we do go from the ankle all the way to the buttocks and sometimes higher, inside, outsides, and the back. And we'll leave the front intact, again, for the same safety reason. Remember, both legs at the same time. This surgery is bigger. It takes longer to recover. The minimum time frame between the surgeries is about 3 months because obviously the recovery is longer. But it significantly decreases the number of surgeries that are required for most of the patients. And it reaches the goal of circumferential treatment. Now let's talk about another thing. Whenever I was trained as a plastic surgeon in cosmetic liposuction, we were specifically told not to go to certain areas, mostly ankles. And the reason is because the way the current liposuction cannulas are designed, if you run them, they're smooth, but at the edges, they're pretty sharp. And if you do your standard liposuction right on top of the tendons, right at the ankle level, you can easily cut or scratch or damage the tendons to your foot and the tendons to your toes. We have developed a technique that protects them, but you have to know that when you go to a plastic surgeon, especially who is going to go to the ankle or the wrist, where there are a lot of nerves and tendons in a very small area, they need to understand what they're doing and they're not damaging the deeper structures, okay? Now, let me mention one more thing that I've seen. With lipedema, when we do circumferential injection of the tumescent solution, you remember the solution that breaks down the fat? It's important to know where you are injecting, because I've seen people inject it in the muscle and then cause compartment syndrome, bad things. So you cannot use the same kind of cavalier approach to liposuction which some people do when they do cosmetic one. They just inject one plane and suck it out and done with it. Especially at the ankles and at the calves and the wrists. You have to be really careful, not only with how you liposuction, but also where you inject. Very important. So that's kind of our approach. Circumferential liposuction, either in the smaller sessions, we do smaller sessions too on an outpatient basis, or larger sessions, which cuts down on the number of surgeries, okay? And then you really have to have a specific post-operative protocol. And the protocol has to do with gradient compression. I'm always confused myself about 10 millimeters, 20 millimeters, 50 millimeters, whatever. I don't know how you can measure that. I think it's very difficult to do. But as your leg swells up, you need to be able to stretch the compression device. And then as your leg shrinks down, you need to be able to adjust it. So we use semi-custom compression garments to create that compressive effect, okay? This way, we're able to decrease the need to drain seromas, which as you probably know, a lot of people have to drain, and it facilitates the recovery. So the compressive garments has to be really semi-custom designed in order to achieve that effect. One more thing to mention is that over the years, we have developed preoperative and postoperative protocols of medications that we give the patients, not only orally, but also IV, to decrease the bleeding. And it's very important. By doing that, we're able to reduce the amount of blood loss by about 3 times. So when you look at that canister of fat, we used to have about 30% of the canister is blood and bloody looking products, and the rest is fat. And now it's 3 times less. So we're very excited that we're getting these results. I know it's a long video, but I'm going to mention one more thing. Please look below and look at the video that relates to the difference between low volume liposuction and a high volume liposuction. Again, you cannot treat them the same. The safety margins is much narrower. If you have a higher BMI and a lot of surgeons turned you down, we might be able to help, or some other people who do high BMI patients will be able to help you out. But you need to make sure that they put all the precautions in place to decrease chance of complications. So again, welcome to our liposuction for lipedema page. Please read it. If we can be of assistance, let us know. Otherwise, we wish you well in your lipedema journey.